we remain in, please, in respiratory system environment with Haapala, Mrs. Haapala from Finland, from the University of Helsinki. Please, the floor is yours.
Thank you. Good morning, everyone. Thank you for the opportunity to come and talk here today. And my topic today is the effect of bovine respiratory disease on the average daily gain of calves in Finland. In Finland, BRD seems to have increased as the sizes of our dairy herds and calf rearing units have increased. I will say a few words about the calf rearing units in case the system is not familiar to you all. So in Finland, the bull cows are collected from the dairy farms at about the age of 2 to 4 weeks, and the cows arrive in the groups of 40 to 80 animals, and they've been collected from several farms. So the calf rearing units are kind of like children's daycare, that children come from different homes and then they play together and lick the same toys and get all kinds of diseases. But our cows are not vaccinated or castrated. And then when they are about 5 months old, they are transferred to a finishing unit where they are kept until they are slaughtered. So the objective of this research was to calculate the effect of BRD on the average daily gain of cows in Finland. So I have listed here the causative agents that what we assumed that were the main causes of respiratory diseases in Finland at the time of the collected data in 2010. And these are familiar to, they are in many countries: Pasteurella, Histophilus, Mannheimia, and etc. But Mycoplasma bovis was first diagnosed in Finland later, in 2012. So we assumed that Mycoplasma bovis was not one of the causative agents in our data. The guidelines for the treatment criteria for BRD were given from the herd health veterinarian of the farms, and it was the same vet for all of the farms. But the diagnosis of the BRD was often done by the farmer itself, and the farmer was the one who decided if they should get antibiotics or not. The medication used most often was oxytetracycline and procaine-penicillin, and in worst cases, if these didn't help, tulathromycin was also used. So we collected data from 5 farms, 5 calf rearing units. We had in total of 21 patches and 1,031 cows. So the farms were quite similar to each other. They were all new, built in the last 8 years. They had a little variation in the amount of animals that they had, from about 300 to 1,000 cows. And the mortality rate varied between 1 to 4.5%. We took about 3 to 6 patches per farm, equally distributed around the year, and there were about 40 to 80 cows in each patch. And we excluded the animals that died or were euthanized. So in the total, in the end, we had 1,031 cows. We didn't have the birth weight, so we estimated it. We used 40 kilograms for males and 36 kilograms for females. So the first weight measurement was done at the time of transfer from the rearing unit to the finishing unit, and this was at about the age of 5 months. And the next weight measurement was at slaughter, which in our data was at approximately the age of 19 months. We did a linear random regression model, and we had age, breed, gender, and other diseases as fixed effects, and farm and patched as random effect. The cows were categorized to be either healthy, having BRD, having another disease, or having both BRD and another disease. And here you have the numbers. And in total, 55% of the cows had BRD. In addition, the frequency of antibiotic treatments were documented. And 44% of the cows did not have any antibiotic treatment, 37% had one antibiotic treatment, and 19% had 2 or more antibiotic treatments. And here's the average daily weight gain for healthy bull calves. I just took the bull calves here. And the live weight gain was 1,040 grams at time of transfer, which was at the age of 5 months. And the carcass weight gain was 547 grams at slaughter. And in case these numbers seem small to you, we have many breeds, but remember that these were the calves from the dairy farms, so we mainly had Holstein and Ayrshire breeds. So here we had the weight gain difference in the different antibiotic categories. This represents the calves that did not have any treatment or antibiotics. This calf, the ones that had only one antibiotic treatment, and this 2 treatments. So if we compare, the ones that were not treated at all grew 59 grams more per day than the ones that were treated twice or more. And then if we compare the ones that were treated once, they grew 35 grams more per day than the ones that were treated twice. And then the difference between these groups, the ones that were not treated and were treated once, was 24 grams per day. Here we have the confidence intervals and the p-values. There was no interaction effect detected between BRD and the other clinical diseases. And surprisingly, the average daily gain had no longer significant difference at the time of slaughter when comparing animals with treatment and no treatment for BRD as calves. We did not have the information about if they had treatments for BRD at the finishing unit, but in Finland, the most of the treatments are localized as to the calf rearing units. So to conclude, calves that have BRD and get at least 2 antibiotic treatments were clearly affected, and their average daily live weight was significantly lower at the time of transfer to the finishing unit. And the animals that were treated only once also had a lower average daily live weight, but it was less affected. By the time of slaughter, there was no longer significant difference. So the animals with previous antibiotic treatments as calves seemed to catch up during the finishing period. We will do research on the effect of Mycoplasma bovis on the average daily gain of cattle, and it will be interesting to see if there will be a difference, as likely there will be. And especially I'm interested to see if there's a difference at the finishing, at the slaughter, if there's a longer effect. So this project was funded by the Finnish Veterinary Foundation, and I'd like to thank the farms included and our co-workers. Thank you for your attention.
Thank you very much. Now we have some time for discussion.
It took longer when I did it myself.
No, it's okay, doesn't matter. Don't worry. Now we can have time for more quiet for discussion. Okay, Geoff, and then yeah.
Very nice. Have you considered looking at the female calves to see if there's any effect of BRD on milk production once they enter the herd? You presented very nice data on the male calves, but what about the other side as well?
There was a really small amount of female calves in this population, so we didn't go deeper into that, but that would be interesting, yes.
It will be expected that should be connection between diarrhea and later BRD, because the cows were in age more than 2 weeks in the study. Probably the majority of cases of diarrhea were not seen as the source. Yes, is it true?
Sorry, the last part I didn't quite get.
Probably you were not able to calculate the number of diarrhea cases because the calves were too young. They were before the transportation to your...
Yeah, I didn't have the information that what had happened at the dairy farms.
Because in the literature are many such reports true. That is connection.
Yeah.
The calf which were ill to diarrhea is more susceptible to BRD. Yes?
But there were some cases of diarrhea also at the calf rearing units, and those that we didn't see the connection between the other disease. But that is true that we don't have the information of the first weeks.
And second is on the comment, this age, 2 to 4 weeks, it is extremely dangerous age from point of view to the susceptibility, because the maternal immunity is something exhausted, and the calves are mixed, stressed, and in Poland this similar situation.
Yeah, that's.
But we should think about change these procedures in the breeding of animals.
Yeah, we've been thinking that about also in Finland. Should we change the system and keep them longer time in the dairy farms?
In your study, you only use live weight as your measure of growth. Any consideration to skeletal development, because it may partly explain the full compensation that occurred? So, for instance, by the time they got to the finishing phase, or at the finishing phase, they may have had the same skeletal development. In research that I've been associated with over the years, we know that live weight is certainly a precise measure, but it's not very accurate sometimes, whereas other measures that may be less precise are more accurate, shall we say. And I just don't know whether you've looked at skeletal development as part of the whole growth process.
Sorry, I have a hard time understanding different accents. Short version.
No, you have the accent.
Next question, please.
Okay, no, if you want to repeat the question, otherwise we... No, okay, let's... Then let's move...
I may answer that.
Yeah.
They didn't do any other kind of measurement of the growth than the weight.
Okay. Are you happy? Perfect.